Head and neck cancers are one of the unrecognized, underserved and poor cousin cancers in the UK. These cancers are rising by 30% per decade. Over 50% of those diagnosed are diagnosed late stage. It has the longest treatment waiting times and one of the highest rates of inequalities.
When patients turn up in early stage disease, it makes a massive difference to their survival and the chances of the cancer ever coming back.
There are deep inequalities across all cancers, across all the healthcare system in the UK, but there are particularly deep inequalities in head and neck cancers. Everyone talks about inequalities. It's almost become a buzzword, but we need to do something different to actually address these inequalities. And we believe the only way you can do that is actually to engage with the communities.
The Afro-Caribbean community in Leicester explained to us that cancer is still a difficult conversation to have, and there is still social stigma about it.
One of the things that the community discussion said, the best way to raise awareness of head and neck cancers is to do some theatre, do a play, promote understanding and awareness through that, rather than coming in and lecturing us.
Listen, guys. It is very, very important that whatever the situation is, even if they're treating us differently as Black people, we have to continue to break down those barriers. And
the Afro-Caribbean community have contributed into the stories, and they've built up their own drama input into it as well.
It got people from our community engaging. They were asking relevant questions, questions that if we were visiting the dentist, questions that if we were visiting the doctors, that we wouldn't ordinarily ask.
In parallel, we found out about a very interesting participatory theatre method, which is called forum theatre, which is a way of engaging and using theatre as a way to address quite difficult, challenging social issues. And through this interactive theatre approach, we will have actors and the community working together to explore an area which is really not very well understood.
For 6 weeks, you get sore throat, and you then lose weight, so they fall for your weight.
Enemies from village, they do this thing. This thing.
Combining the community actors play and the forum theatre play worked really well. It basically broke down the barriers because these were members of their own communities taking action to promote awareness.
The main thing people took away was about the relationship and how if you ask questions, you can change that relationship with your doctor, dentist, whoever it is. It's about asking questions, and don't be afraid to ask the questions.
I'm worried about my family.
So what are you worried about? What are you worried about?
We really hope that on the back of this project we can demonstrate that doing innovative work with and in combination with communities based on what they think we should do, we will be able to start to address some of the late diagnosis that is affecting the late treatment and the poor outcomes for patients affected by head and neck cancers.